Next up, to kick off our conference, is the first panel of the day. And this panel includes Dr. Shelley Francis of EB Noir, Dr. Chandra Ford with UCLA, and Dr. Jacoby Wilson, University of Maryland, for a timely level-setting discussion specific to the historic context of mobility and opportunities with the newly signed infrastructure bill, and more importantly, why the decarbonization of our current transportation system is so critically important.
Greetings. Welcome to the National E-Mobility, Diversity, Equity, and Inclusion Conference. I'm Dr. Shelley Francis, co-founder of EB Noir. I'm wearing a white jacket and an orange dress. Thank you to Terry and Jeff for kicking things off and getting us warmed up. I hope that you're as excited as I am and we are to kick off this year's conference. So I have the pleasure of facilitating our next panel with two of the leading voices in the space who will share their perspectives on everything from public policy to environmental health, health disparities, as well as the historical context of transportation and mobility on the environment and public health. So the current administration, as you're well aware, has passed the most important infrastructure and transportation legislation in the last 50 years. Now, this investment has the opportunity to be transformational for communities, especially communities that are disproportionately impacted by transportation emissions and have been left out of the policy, programs, and research in this sector. Now, how can we ensure that these benefits from the legislation and other programs such as Build Back Better, Justice 40, impact and transform communities that can benefit the most? So during this discussion, we'd like to do the following. We want to provide a high-level overview of the proximate and distal factors that are intersected with environmental health and transportation emissions. We also want to discuss the importance of acknowledging the historical context, community perspective, as well as the implications on mobility and accelerating clean multimodal transportation. And then finally, we want to hone in on what's next. So where do we go from here so that frontline vulnerable communities, African American, Latino, Hispanic, and tribal communities particularly benefit from this investment? So this session is going to set the stage for your next 2 days of exploration of a myriad of issues around e-mobility. So let's get started. I'd like to introduce our two esteemed panelists. Dr. Jacoby Wilson is an associate professor with the Maryland Institute for Applied Environmental Health and the Department of Epidemiology and Biostatistics, School of Public Health at the University of Maryland, College Park. Dr. Wilson has over 15 years of experience as an environmental health scholar and is also the founder and director of the Community Engagement, Environmental Justice, and Health Initiative, CEJA. CEJA's focus on providing technical assistance to communities fighting against environmental injustice and environmental health disparities in the DMV region, as well as across the nation. So welcome, Dr. Wilson. Great to have you here today. Next, I'd like to introduce Dr. Chandra Ford. Dr. Ford is Professor of Community Health Sciences and the founding director of the Center for the Study of Racism, Social Justice, and Health in the UCLA Fielding School of Public Health. She is the lead editor of Racism, Science and Tools for the Public Health Professional, which was named an outstanding academic title for 2020 by the American Library Association's Choice magazine. Her work offers conceptual and methodological tools for studying health disparities and racism as a public health problem. She also, along with Dr. Collins, has created and crafted the public health critical race practice, which is an approach for applying critical race theory empirically. So to get this conversation started this morning, I will ask you all to just share briefly about your work and how it's relevant to framing our discussion around e-mobility, diversity, equity, and inclusion. So Dr. Ford, why don't you go first today?
Good morning. What a pleasure to be here and to share this panel with Dr. Wilson. And thank you for doing this work, this important work in the field and in our society. I would start by saying that so much of our focus in terms of public health focuses on what we might think of as proximal determinants, those things that we can very readily see as relevant to health. We think of them in terms of, for instance, biology, genetics, those kinds of things. For health educators, this has meant focusing on people's risk behaviors or their attitudes towards engaging in the things that we're trying to promote people to engage in. But there are these more distal factors, the conditions in which people live, in which they work, in which they play, that play a critical role in undergirding even the options available to people in terms of, for instance, we think often of food. And while health educators often want people to eat healthy food, it's important to consider the context in which they live, because that determines whether or not healthy food is available to them. So we have to begin to take stock of these social and political determinants of health, in addition to considering the more proximal determinants of health. And that's part of the reason why thinking about the environment and environmental inequities is critical to addressing related health inequities.
Thank you for that, Dr. Ford. So now, Dr. Wilson, we'd like to hear from you next. So how does your work align with DE&I in the e-mobility sector?
Yeah, thank you for having me today. Shakobi, I'm bald. I got a blue jacket on for everybody out there. And so this work is really important. And you think about from an environmental justice standpoint, we're talking about environmental injustice of the EJ movement. We're talking about how there's a differential burden of hazards and locally wanted land use in certain communities. So we're talking about where people live, where they work, where they play, where they pray, where they learn, right? And you think about transportation, and Dr. Ford talked about it. You think about structural factors, social determinants. One of those social determinants is racism, right? And you think about racism in transportation sector, you got to look at the history of highways and byways built through Black and brown communities. Look at the National Highway Defense Act. Secretary Buttigieg recently talked about bridges and structural racism. There's been some people think that's comical and like how is racism related to transportation. But if you look at this sector, highways and byways was built on purpose through Black and brown communities to lead to fragmentation of those communities, right? To lead to those communities being used for traffic-related air pollution, right? The fact that you got combustion of fossil fuels that leading to public health impacts. We talked about asthma that earlier. Think about the disparities between Black children, white children when it comes to asthma. You have a lot of kids who live near these highways and byways who've been exposed to combustion byproducts like particulate matter, which can cause asthma attacks, not just asthma attacks. It can cause strokes, elevated blood pressure, cause heart disease, right? It can lead to increased infant mortality, birth defects, low birth weight birth, right? It can cause Alzheimer's, okay? Diabetes, cancer. It can lead to premature mortality and impact your life expectancy. That's just one combustion byproduct. You got volatile organic compounds. We got children of color who disproportionately ride school buses, right? Volatile organic compounds impact their short-term coordination, focus, and concentration. So how are we going to make sure our kids learn a bit of their basically riding smokestacks to school, right? So you think about transportation, you think about racism, you think about public health, those things are connected. And I would like to end, so we go to the next question with saying electrification is a public health intervention. EVs are a public health intervention. Autonomous vehicles are a public health intervention. Back to you, Dr. Francis.
Thank you, Dr. Wilson. And we're going to take a deeper dive into EVs as a public health mitigation strategy as well. But I want to first just highlight the framework that we're looking at this conversation through. And Dr. Ford, I'm going to lead with you. So as a researcher, as a practitioner, as a scholar who's trained in public health and health disparities, let's talk for a minute briefly about the social determinants of health. You brought that into your introduction in terms of framing your work. Talk about how it intersects with mobility, public health, and environmental health. And you may also just need to briefly define what the social determinants of health framework is for those who are attending who are not as familiar with that framework.
Sure. So we use the term social determinants of health to talk about things like transportation, like unemployment, like many of the sort of social and economic conditions in which the health risks of people and communities are embedded. The Robert Wood Johnson Foundation has really been urging all of us to think about this from the perspective of action in terms of health and all policies in a way that's trying to find ways to engage our policies and our actions at the community levels by addressing these social determinants of health through partnerships with various anchor organizations like private organizations, companies, businesses, and of a wide range of stakeholders in various communities who are impacted um, in this case, pollution, by EV inequities, and so on. So, from a social determinants perspective, um, my work has really sought to shift the focus from trying to identify characteristics about individuals, for instance,
Mhm.
that lead them to have poorer access to, for instance, these more economical options, um, and instead shift to the historical and structural factors that lead to these problems. So, for instance, one thing we're doing is examining the historical patterns of historical residential segregation that leads some communities to be excluded from opportunities, even today, including access to a variety of resources, including, I would argue, those that are tied to environmental health, including um, e-mobility.
Thank you for that, Dr. Ford, because it's really important to have an understanding of how we need to approach this work, and utilizing this framework particularly is really informative when you think of all the competing factors that are really helping to accelerate this phenomena around transportation emissions, as well as how that impacts the health and well-being of disadvantaged and under-resourced communities. Now,
Let
Dr.
me just
Oh yeah,
let me just add one more thing.
mm-hmm.
What are the implications of what I'm saying?
Mm-hmm.
The implications are that our first tendency might be to reach out to individuals and try to encourage them to see the value of shifting how they themselves work in their own homes, in their own households, how they and just think about it as something that individuals need to change about themselves. A social determinants perspective says that what we need to do is focus on changing the policies that undergird what's available in communities
Mm-hmm.
as a first step. And then communities and community members, who do, by the way, have their own best interests at heart, so they are interested in their own well being, will be in a position to make decisions that protect their health and that promote e-mobility and other health promoting uses in terms of environment as well.
Thank you, Dr. Ford. So this approach is much more macro and community level in
Yes.
terms of, compared to being more individualistic in terms of the approach. And so thinking about how communities were segmented, how communities were formed, is a really critical piece of the conversation, and it really helps us understand what we need to do differently to be able to dismantle some of these systemic inequalities and inequities. So, Dr. Wilson, this is a question that's geared to you. I always say that we can't have a dialogue about transportation, about mobility in diverse communities without really, acknowledging and discussing where we've been. So, whether we're talking about Plessy versus Ferguson or the civil rights movement around mobility and how that was a centerpiece of the civil rights movement, or you brought up earlier the Federal Aid Highway Act of 1956 and other federal legislation that disrupted or intentionally disrupted Black and Brown community to help accelerate movement out of cities into the suburbs. Let's discuss the historical context of institutional and environmental racism and how it plays out in transportation.
Yeah, no, thank you for that. If you think about, so we talked about, racism and social determinant. We talked about structural racism. What is environmental racism? Environmental racism is basically the placing of these hazards, certain uses in certain communities based on their race, or it's the fact that the people who are making decisions don't look like the folks who be most impacted by those decisions. So if you think about the environmental justice movement again, right? You think about the Dr. King in many ways, the grandfather of the EJ movement when he was assassinated almost 54 years ago in Memphis. The sanitation workers strike. You look at the work of folks like Dr. Robert Bullard, the book Dumping in Dixie. Dr. Bullard's written about transportation inequities in Atlanta, Georgia. How when it comes to mass transit stops only go in certain neighborhoods, certain communities, right? So inequities in planning, zoning, development create environmental injustice. And so in equities and development, is like the SMART group, is like the transportation planning, creates environmental injustice. In equity and opportunity structures, as relates to transit-oriented development, is a form of environmental injustice, right? So if you have mass transit where it's only going to certain communities, if you have highways and byways dumping air toxicants in certain communities, those policies are drivers of the negative impacts when it comes to poor transportation planning, right? Those policies are the drivers when it comes to certain communities not having access to transportation when it comes to climate change, for example. Think about Hurricane Katrina. There are a lot of folks who didn't have cars who couldn't get out of New Orleans. Hurricane Ida just hit Katrina again, just hit New Orleans again 16 years later, a couple months ago, right? So if you have communities that are planned a certain way where they don't have access, they don't have the mobility options, it creates conditions where you're going to have differential burden of pollution, differential burden of access to infrastructure, and you're going to have these differential health outcomes. So what we're saying is, if you're going to address this issue through an e-mobility lens, we have to move from unjust transportation to just transportation. And so by looking at e-mobility and through that lens, e-mobility, how can it be part of this social justice frame? How can it be part of our social justice movement by making sure there's options for all Americans across income, across race, particularly those who've been left behind, who've been marginalized, and who've been invisibilized by our policies, including our transportation policies.
Thank you for that, Dr. Wilson. Dr. Ford, is there anything else that you'd like to add in terms of, how do we move from unjust mobility to just mobility?
I think that the work that Dr. Wilson has done in terms of community-based participatory approaches, which are approaches to carrying out research or even interventions that start not with the researcher, but with the researcher's relationship to community, will be critical, because these approaches are ground-up approaches that they have the opportunity to be sustained over the long haul, because they reflect the perceptions, experiences, the wealth, they draw on the wealth of riches and insights that communities have. So what am I saying? We researchers sitting in our academic institutions can offer a lot of insights, but they're more likely to be effective and meaningful if they reflect the meaningful and substantive engagement of community members who are impacted by these decisions at every stage of the research process.
Dr. Ford, thank you so much. That is such a critical point because, in thinking about the approach that we utilize in our work, we approach it from that very lens where it's a human-centric approach. And as a former academic medical professor specializing in health disparities, that's the way I want to approach the work, in partnership, hand in hand with community partners. So not working in isolation or coming in and saying, like, I know what your challenges, your issues are. It's really critical to make sure that you're working in tandem and letting community partners and communities help drive the solution. Because we always say the individuals who are closest to the problem are usually closest to the solution.
Exactly.
Yes. And so, Dr. Ford, I know you're a busy academic, and we appreciate your taking the time to share your expertise and understand that you need to get back to your teaching duties today. So Dr. Wilson and I are going to continue to facilitate this discussion, but thank you again for your time.
Thank you, and I celebrate you all for pulling this together, and I encourage you all to have a wonderful rest of your conference. Thank you.
Thank you so much.
Bye-bye.
Bye-bye.
So Dr. Wilson, Dr. Ford led into a really critical conversation or thinking about the community-based participatory research practice approach. And, it's just you and me now and our, hundreds of our attendees here. I would like to hear your thoughts about the infrastructure bill, because obviously we can't have this conversation today without touching on the infrastructure bill, Build Back Better, Justice 40, and prioritizing frontline and vulnerable communities. So how do we ensure that communities are on the receiving end of this transformational funding to accelerate clean multimodal transportation, and we're not creating further opportunities to help facilitate additional inequities? So we want to make sure that as some in the military say, no one's left behind. So how do we ensure that we're shifting the paradigm in how we implement this transformational funding, infrastructure, etc.
Yeah, thank you for that question. I think as Dr. Ford mentioned, the partnerships are really, really important. Those folks who are at the front line and fence line. I like to say folks who are at the front line should be at the front of the line, so everybody y'all can use that one. But how do you make sure they're at the front of the line? So you have to find those organizations, those networks, those coalitions, those alliances that are already engaged in these issues. There are a lot of groups that are engaged in looking at climate change and transportation issues. There's a whole discussion about the Transportation Climate Initiative, right? There are groups, for example, APIN in California. You have the National Black Environmental Justice Network. You have the Baltimore, for example, City of Baltimore, the Baltimore Transit Equity Coalition. You got the Purple Line Coalition in Prince George's County, Maryland. You have folks who are doing work in New Jersey and New York as part of New York, New Jersey EJ Alliance. So you have the North Carolina EJ Network, the South Carolina EJ Network. You got the climate, Climate Justice Alliance. And so you got these different alliances and networks that you can be connected to. I think that's one thing to do. I think when it comes to as the dollars come down, particularly if you look at Justice 40 first, so those of you know what Justice 40 is. Justice 40 is part of the Executive Order 14008. President Biden, it has 4 components, but the Justice 40 component says as we move from a dirty energy economy to a clean energy economy, 4% of the benefits should go to disadvantaged communities. So in the context of this conference, we're talking about disadvantage, partly been this unjust transportation and the impacts, the accessibility issues, the cost issues, the environmental impacts, the human health impacts. So we have to make sure that those Justice $40, and in the context of this discussion again, transportation dollars, for example, that they're going to those communities that have the most needs. So what kind of tools are you using to identify those communities that have transportation needs, who need e-mobility, right? What kind of mapping tools? You have US EPA Environmental Justice Screen. California has a tool called a Calibarro Screen. California also has a transportation-specific tool. State of Massachusetts has a transportation-specific tool. So you can target communities with the most need, right? So then you have, okay, how do we make sure to get the dollars? You have to make sure the systems that are doling out the money, that those monies are going to the right communities, right? So we have to have some guardrails there. You look at the infrastructure bill. The infrastructure bill has money for mass transit. The infrastructure bill has money for EVs, right? The infrastructure bill has a lot of dollars that could be used to help address some of these issues that we've addressed. Remember, I said electrification is a public health solution. EVs are a public health solution. Autonomous vehicles are a public health solution. They're only solutions if you have equity. So again, you have to have metrics, systems in place that make sure the folks are most impacted. So the Fords of the world, the GMs in the world, how are you engaging those communities in workforce development? There's a whole workforce component of e-mobility we have to be focused on. We have to create economic opportunity structures for folks who've been left behind, right? So how do you make people whole? How can we have restorative economy through this infrastructure bill? We have to have a workforce development, a jobs piece, right? We have to make sure that we are engaging on the education and STEM aspects. And we also have to make sure that we're giving those communities the benefits, right? There's 4 buckets of benefits that we need to see out of infrastructure bill: economic, social, environmental, health benefits. So how are we making sure again that we are going to be working with those communities, grassroots communities, community development corporations, right? The transit authorities have to step up and have more equity at the state level, because it doesn't matter what we do at the federal level if the state agencies and these transportation agencies at the state level are very complicated. In the state of Maryland, we have like 8 different agencies that are part of the Department of Transportation. How are they making sure they have their own equity and justice plan and making sure they apply it to those dollars that are going to be coming through their agencies to those communities? So I'll stop there, but there's a lot of things that need to happen. But I think equity has to be integrated into these plans, and then having guardrails and accountability metrics as well.
Thank you for that, Dr. Wilson. And so, one of the major things is that, obviously, from what you just shared, public policy in this instance is really setting the tone for how we move forward beyond this moment in time. But beyond public policy, public policy is just a piece of the puzzle. So it's one of the multiple pieces that we need to put together to make projects, processes move forward. But we know that sometimes in public policy, examples from e-mobility in the past, whether it's incentives and rebates or other ways to motivate people to transition to clean transportation, it hasn't often filtered down to those communities that need the support and the opportunities, the infrastructure the most. So I'm talking specifically calling out frontline and vulnerable communities, the tribal communities, African American, Latin, Hispanic communities are often those communities that are in the margin and have not been able to really participate and benefit from various forms of public policy that were aimed to accelerate electrification. So although we have this awesome opportunity to really leverage this transformational infrastructure policy, what other things do you think, based from your purview, do we need to put in place to make sure that, again, that these communities are, provided the same access and opportunities that we see in majority communities?
Yeah, I think we have to start with them first. I mean, a lot of the communities that I'm talking about. I mean, when it comes to some of the dollars that are going to be available, they don't have the capacity to apply, capacity to get, capacity to use, the capacity to see impact, the capacity to evaluate the dollars. So we got to work on building capacity. So I think, think about some public-private partnerships, with those who are in e-mobility space. How can you have public-private partnerships with a lot of the coalitions and the organizations that are doing the work on the ground? There may be community infrastructure, social infrastructure, justice infrastructure that can be activated, right? Maybe they don't see e-mobility like, man, this is not part of justice. I think it is part of the social justice. So who are those justice groups that you can be engaged with, who are already working with those hard to reach populations, who are already working with populations that are dealing with pedestrian safety around areas there's too much construction or dealing with, big truck traffic. There are a lot of communities, for example, who are dealing with goods movement. Y'all know what goods movement is. Y'all see that on TV with the cargo ships that are stuck in our ports, right? So you got the seaports, you got the airports, you got the coastal ports, you got the river ports, right? You got the warehouses too. Goods movement is a big issue for many Egypt communities. Work with those folks in the goods movement. Look at the Moving Forward Network. That's a group you can partner with. Angelo Logan leads the Moving Forward Network. Electrify our fleet vehicles at the ports. Electrify our fleet vehicles at our warehouses, like the Amazons of the world, right? Electrify our fleet vehicles when it comes to our cities. And working with those community partners who have been impacted, right? That's where you got to start. Working with those partners, engaging those community groups who are doing this work, activating infrastructure that is in that community, that's valued, that's respected. That's how you do this. And again, I'm gonna go back to workforce development. Working with people like Civic Works in Baltimore, other workforce development groups. That's another way, because the economic opportunity angle is another way to bridge and making sure that the communities that are most impacted are seeing benefits.
Thank you, Dr. Wilson. And I think, my concluding question was really going to tap into some of the information that you just shared in terms of actionable items, actionable tactics and steps. Because when we have conversations like this, people that are sitting in the audience, want to know, like, okay, like, what can I do? What can I take home and take away from this conversation that I can implement in my own work, in my practice? And so, some of the things that you shared in terms of keying in on the public-private partnerships, who are those different organizations and groups that are mobilizing some of those diverse segments that we just spoke about. And also making sure that, while we want people to transition to clean transportation and multimodal clean transportation, we also really want to make sure that we're providing that workforce and economic development opportunities. So jobs, good paying jobs, so that people can really take advantage of this acceleration of this transformational opportunity in transportation and really benefit long-term and not just, an intermediate benefit. So
Exactly.
just, as always, we were always happy to have this conversation with you. And thank you so much again for sharing your time, your expertise. And we look forward to continuing to work with you and the schools to really make sure that we're accelerating equitable multimodal transportation solutions for all communities.
Thank you for the opportunity to speak today.
Thank you very much. Have a great day.